Tonight, an important warning. In a recent survey of more than 860 EMS agencies across the country, 69% of responders report a decrease in responses. Since the onset of the coronavirus here locally, Madison County has seen a 20% reduction overall and 25% fewer calls related to cardiac events. Jon Howell, the CEO of Huntsville HEMSI, joins us now. Thank you so much for being with us tonight.
Oh, sure. It's my pleasure.
So what seems to be the issue with the decrease in calls?
What we believe is, of course, is that our community is experiencing a lot lower level of activity, and that's fine. That lower level of activity has also helped us keep our number of positive cases down. But there has been some concern that people may be avoiding going to the hospital even when they need to for serious medical conditions. And they may be avoiding calling 911 and using the EMS system because they're concerned about the possible contagious nature of the coronavirus. So we're trying to let everyone know that it's very safe to still use 911 and to go to the hospital when you need to go to the hospital.
What are HEMSI's protocols for answering 911 calls?
Well, our 911 call answering protocols are fairly detailed, but they provide us the opportunity to triage out our calls and be able to segregate the most serious calls from the least serious calls. And the most serious calls will get an immediate response, usually of an advanced life support ambulance as well as first responders. And the least serious calls may not get as quick a response, but usually get an immediate response that may be just a little bit slower.
What safety procedures are in place?
So what we're doing to make sure that our vehicles and our staff are safe to interact with the public is, first of all, we have our staff wearing masks, reusable cloth masks, usually when they're just out in the public, and that's helping to protect the public from anything they might catch from them. But we're also taking a fairly detailed approach to cleaning our ambulances after every call. All of our patient services get wiped down with a disinfecting solution. And then if we do a call where we think the likelihood is high that we might have transported a patient with the coronavirus, we have some special equipment that we've acquired that we will use to put a special mist of type of disinfectant into the ambulance that will get into every part of the ambulance possible and will help disinfect it very thoroughly.
What should you expect if an emergency responder comes to your home?
Well, if you have called an emergency responder to your home in today's environment, you should expect to get some questions asked before they ever get there. And the questions are not only going to be about what's wrong with you for this particular episode, but you're going to get some questions about, do you have a fever? Do you have a cough? Have you been in contact with people who might have had the COVID disease or been exposed to the coronavirus? And you might also get asked those questions by the EMS personnel when they first arrive. They may be wearing personal protective equipment. They may have on a face shield. They may have on a mask. They may have on a gown. And these are all just to protect them for any likelihood of exposure. But it's not going to interfere with how they take care of you. And it can actually enhance the safety of the patient by preventing them from being exposed to anything that provider may have on their uniform or been exposed to on a previous call.
Any other important information that you can provide for us tonight?
Well, I just want our community to know that your EMS systems are safe. It's very appropriate to call 911 still. It's your best chance to live is to go to the hospital and get treatment for these serious health conditions. We would much rather treat you while you're conscious and alert and just starting to experience symptoms than later on when you may actually suffer out-of-hospital cardiac arrest. So remember that minutes are going to matter, and to call 911, and hopefully no one will ever need to, but if they do, we'll be able to deliver good care.
Thank you so much for your time tonight and for the life-saving work that you do.
Well, thank you.